silent, stealthy, deadly. Few words capture the hidden danger of clogged arteries more accurately. This is one of the greatest health threats silently affecting millions, often without a single clue. At this very moment, your arteries could be narrowing, restricting precious blood flow to your brain, heart, and limbs. In the United States, someone loses their life to cardiovascular disease roughly every half a minute. Yet here's the staggering reality: many of these tragedies are preventable if the early signals are recognized and acted upon. The heartbreaking part is that your body rarely stays silent. It constantly sends out alarms when circulation is compromised. But these warnings often appear as ordinary nuisances, easy to dismiss. That nagging fatigue that lingers for no reason, the breathlessness that shows up on a simple flight of stairs, the leg cramps that appear during walks, these aren't always just byproducts of aging. They could be your body's urgent messages that your vascular system is under serious strain. Before we break down these potentially life-saving red flags, if you're new here, welcome to a community dedicated to protecting your cardiovascular health. Subscribe now and tap the notification bell so you never miss essential content that could safeguard your future. Drop a comment below telling us where in the world you're tuning in from. We love hearing from our global family of health-focused viewers. Today, we're revealing 10 powerful warning signs that your arteries may already be dangerously clogged. These aren't mild inconveniences, they are scientifically backed symptoms that could spell the difference between timely treatment and a life-threatening emergency. What you discover here might literally save your life. 1. The 6 Ps of sudden limb ischemia. One of the most dangerous signs of a critical arterial blockage is sudden limb ischemia, often summarized by the 6 Ps: pain, pallor, pulselessness, paresthesia, paralysis, and poikilothermia. This condition arises when blood flow to a leg or arm is abruptly cut off, creating a life-threatening emergency. The pain is abrupt, unrelenting, and sharp, often described as searing deep inside the muscles, worsening rapidly as tissues are deprived of oxygen. Pallor is seen as a stark color change. The skin becomes chalky, ashen, or almost bluish compared to the opposite limb. Pulselessness is identified when the normal arterial pulses below the blockage vanish completely, even when checked at multiple points by a clinician. Paresthesia develops as the nerves starve of oxygen, causing pins and needles sensations or complete numbness. Paralysis follows when muscle fibers and motor nerves begin to fail, starting with weakness, and quickly progressing to total loss of movement in toes, fingers, or even the entire extremity. Poikilothermia, the final sign, is when the limb feels unnaturally cold, unable to hold its normal warmth without circulating blood. These features highlight how critical time becomes. Cells can only withstand oxygen deprivation for a short window, often just a few hours, before damage is permanent, sometimes making amputation the only option. The appearance of multiple PS signals an urgent surgical crisis, where every passing minute could decide whether the limb can be preserved or lost. 2. Transient ischemic attack. A transient ischemic attack, often called a TIA, is a powerful warning that arteries in the brain are narrowed or blocked, causing short-lived interruptions in blood flow. TIAs mimic strokes, with nearly identical symptoms, but unlike a major stroke, the effects vanish within minutes or sometimes a few hours, never lasting longer than a single day. This temporary recovery deceives many into thinking the event was harmless, yet it signals a dangerous underlying problem. The signs are sudden and striking. You may experience weakness or numbness on one side of the face, arm, or leg, leading to a crooked smile or difficulty lifting an arm. Speech can suddenly become slurred, fragmented, or nearly impossible to produce, even though thoughts remain clear. Some struggle to comprehend spoken words, while others face abrupt vision loss, double images, or missing sections of their visual field. It can feel as if part of your sight has been erased by an invisible curtain. Neurologists warn that TIAs must never be dismissed. Roughly 40% of individuals who experience one will go on to suffer a full stroke if nothing is done. The carotid arteries in the neck are often the culprits, gradually narrowing with plaque, build up until blood clots form and break loose, traveling into smaller vessels of the brain. When these clots cut off oxygen delivery, the regions controlling language, movement, or sight falter, producing the terrifying symptoms of a TIA. Even when the episode resolves completely, the danger remains. A TIA is not a benign event, it is the body's urgent alarm that a catastrophic stroke could strike at any time. Immediate medical evaluation is essential, because intervention after a TIA can prevent a far more devastating outcome. 3. Erectile dysfunction. Erectile dysfunction is often the body's first hint that arteries are narrowing, sounding the alarm well before more recognizable heart or brain symptoms appear. Erections rely entirely on robust blood flow through delicate penile vessels. When those small channels begin to clog, performance falters, often long in advance of problems in larger arteries. Extensive clinical research links erectile dysfunction with cardiovascular disease. Because penile arteries are narrower than coronary or cerebral vessels, they tend to show the impact of plaque earlier, acting like a canary in the coal mine for your circulatory system. Men who develop erectile difficulties, particularly when no clear psychological trigger is present, face a markedly higher likelihood of future cardiac events, cerebrovascular complications, and peripheral artery disease. The takeaway is timing. Erectile dysfunction frequently emerges well ahead of other warning signs, giving a valuable window to uncover and treat hidden vascular disease before it escalates. While stress, aging, and emotional factors can contribute, the vascular dimension should never be dismissed. When erectile problems arise without obvious psychological causes, especially in midlife or later, a thorough cardiovascular evaluation is warranted. This symptom underscores how unified your circulation truly is. Trouble in one region often mirrors trouble throughout the arterial network. Paying attention to erectile function isn't just about sexual health, it can be a life-saving check-in on your heart, brain, and entire vascular system. 4. Non-healing foot or leg sores, persistent coldness, and color shifts. Visible changes in the feet and lower legs, wounds that refuse to close, a lasting chill, and altered skin tone, signal severely reduced circulation. These findings point to advanced peripheral artery disease, meaning arterial narrowing has progressed to a dangerous stage. When vessels that feed the extremities are critically obstructed, tissues no longer receive the oxygen and nutrients required for normal repair or for keeping surface temperature stable. Ulcers that linger far beyond a typical healing window are a hallmark. Because delivery of blood is compromised, damaged skin struggles to rebuild, and even small cuts can remain open for an extended period. A continual sensation of cold in the feet or legs, especially when the rest of the environment is warm, strongly suggests major vascular compromise. Healthy circulation helps equalize temperature. When flow is restricted, the distal tissues feel persistently cool. Color changes offer more clues. Skin may turn pale, take on a bluish cast, or appear taut and shiny when perfusion is poor. Patchy, mottled areas can reflect uneven blood distribution. Thinning or loss of hair on the shins and feet is another classic indicator. Hair follicles are highly sensitive to reduced blood supply, so growth slows or stops when circulation declines. A side-to-side temperature gap is particularly revealing. If one foot or leg consistently feels cooler than its counterpart, that asymmetry points toward a localized blockage affecting that limb. Taken together, these signs are the body's visible proof of dangerously limited blood flow and warrant prompt vascular evaluation. 5. Leg pain or cramping with walking. Achy, tight, or cramping pain that shows up while you walk and fades after a brief rest is a classic sign of peripheral artery disease, PAD, where the arteries feeding your legs have narrowed. The discomfort often settles in the calves but can also strike the thighs, hips, or buttocks, and it may feel like heaviness, fatigue, or a deep muscular squeeze that reliably returns with exertion. PAD rarely exists in isolation. Vascular specialists emphasize that blockages in the leg arteries often travel with disease in other critical vessels, including those of the heart and brain. That's why intermittent claudication isn't just a leg problem, it's a whole body warning that your arterial system is under strain. The physiology explains the pattern. Plaque-narrowed leg arteries can usually keep up when you're at rest, but the moment your muscles demand more oxygen during activity, supply falls short. The result is predictable: exertion-linked cramping caused by temporary oxygen deprivation. The distance at which pain appears tends to be consistent from day to day, and relief arrives within minutes once you stop. Many people write this off as aging, poor conditioning, or a simple muscle pull. True intermittent claudication has telltale features. It's reproducible, triggered by walking, and reliably relieved by rest. Over time, the threshold often shrinks, from long strolls to short trips across the room, gradually intruding on everyday life as arterial narrowing progresses. Epidemiologists estimate that PAD burdens tens of millions of people worldwide, and many millions in the United States, especially among midlife and older adults. If your walking pain matches this pattern, treat it as a cardiovascular red flag and get evaluated. Early recognition can change the trajectory of both your leg health and your overall vascular risk. 6. Pain that radiates beyond the chest. When the heart is starved of blood because the coronary arteries are narrowed, the discomfort doesn't stay neatly in the center of the chest. Cardiac pain often borrows nerve pathways shared with other regions, so the signal can surface in the shoulders, one or both arms, the upper back, neck, jaw, teeth, or even the upper abdomen. That wide reach creates a confusing map of symptoms for patients and clinicians alike. Classically, arm pain on the left raises alarms, but heart-related discomfort can involve either side, and sometimes both. The sensation is more often a weight, squeeze, or deep ache than a sharp stab. Pain between the shoulder blades is frequently written off as a pulled muscle. Jaw or neck pain is commonly blamed on dental issues or a stiff neck, yet when these symptoms appear with exertion and ease with rest, or accompany other heart warnings, the pattern strongly suggests a cardiac source. It can masquerade as a stubborn toothache, but the timing and triggers tell the real story. Upper abdominal discomfort may be the most misleading presentation. What feels like simple indigestion can, in fact, be an urgent heart problem. The danger lies in chasing the wrong fixes, seeing a dentist for jaw pain or reaching for antacids for epigastric burning, while hidden coronary blockages continue to threaten your life. When pain spreads beyond the chest, especially with exertional onset and relief at rest, treat it as a potential heart emergency and seek immediate medical evaluation. 7. Unexplained cold sweats and debilitating fatigue. Cold, clammy sweating that strikes out of nowhere is a high alert signal. Unlike the perspiration you feel from heat or exercise, these cold sweats reflect the body under duress, often because vital organs aren't getting enough blood. When arteries are narrowed and the heart struggles to keep up, the stress response kicks in, releasing hormones that trigger sudden, slick moisture on the skin. Equally concerning is profound fatigue that doesn't lift with rest. This isn't ordinary tiredness, it's a heavy, whole-body drain. As coronary arteries narrow, the heart's pumping efficiency slips. To compensate, it beats faster and works harder, but that extra workload wears the muscle down. What begins as cardiac strain soon feels like total exhaustion from head to toe. Women, in particular, may experience sweating and fatigue as leading signs rather than the classic chest pain. Many describe an abrupt, unexplainable energy crash that precedes a cardiac event. If cold sweats or overwhelming fatigue appear without a clear cause, especially when paired with other heart-related clues, treat them as urgent warnings and seek immediate medical evaluation. 8. Dizziness, lightheadedness, or sudden nausea. This trio is your brain's SOS for oxygen. When arteries feeding the heart or brain are narrowed, circulation can't keep pace, and the result is a sudden sense of spinning or near fainting as the brain's fuel supply dips. Clinicians often see these symptoms cluster during cardiac events because they share a single driver: reduced cardiac output from obstructed coronary vessels. As the heart struggles to pump, blood pressure falls, cerebral perfusion drops, and the room can feel as if it tilts beneath you. The nausea matters just as much. Your digestive system is energy hungry. Under circulatory strain, the body reroutes blood toward the most vital tissues, leaving the gut shortchanged. That diversion triggers queasiness, sometimes with vomiting and a clammy sweat, even when you haven't eaten anything questionable. Many people chalk these sensations up to stress, dehydration, or a skipped meal. But when dizziness, lightheadedness, and sudden nausea strike together, especially alongside chest pressure or shortness of breath, consider it a red flag for serious arterial compromise. Treat the combination as an urgent warning and seek immediate medical care. 9. Shortness of breath. Unexplained breathlessness isn't the normal huffing and puffing after a hard workout. It's finding yourself winded during everyday tasks that never used to bother you, or even struggling to catch your breath while sitting still. This warning sign often creeps in gradually, making it easy to rationalize away. When arteries are narrowed, the heart can't move blood efficiently to the rest of the body. Think of a pump pushing against a clogged filter. No matter how hard it works, too little flow reaches its destination. Starved tissues signal for more oxygen, and your body compensates by speeding up and deepening your breathing, trying to squeeze every drop of oxygen from each inhale. Clinicians recognize that persistent dyspnea can be an early hallmark of heart dysfunction that develops after long-standing arterial narrowing weakens the heart muscle. As the heart strains, it becomes less effective, pressure rises in the circulation, and fluid can begin to back up toward the lungs, making breathing feel heavy and effortful. This sign deserves special attention in women, who more often present with shortness of breath, as a leading symptom of heart disease rather than the typical chest pain. The trajectory is worrisome: breathless on stairs, then on level ground, then during simple routines like dressing or holding a conversation. That downward progression reflects a failing ability of the heart to meet the body's oxygen demands, and it's a countdown to more serious events. If this pattern sounds familiar, treat it as urgent and seek a prompt cardiovascular evaluation. 10. Chest discomfort, angina. The most telling early signal is chest discomfort, what clinicians call angina. Here's the trap: it rarely looks like the dramatic, crushing agony from movie scenes. More often it feels like pressure, tightness, squeezing, or a deep, unsettling ache across the chest. What's happening under the surface is simple and serious. Your heart muscle runs on a steady stream of oxygen-rich blood. When plaque narrows the coronary arteries, it creates a choke point. The moment demand rises, climbing stairs, hurrying to catch a bus, or riding an emotional surge, your heart asks for more oxygen, but the restricted vessels can't deliver, and the muscle registers distress. This discomfort doesn't always stay put, because the heart shares nerve pathways with other regions. The sensation can radiate outward, to one or both arms, often the left, the neck, jaw, upper back, or even the upper abdomen. Many people mistake it for a musculoskeletal pull or stubborn indigestion, especially because of its on-exertion, off-at-rest rhythm. It flares with activity and fades when you stop. Every episode is your heart signaling a supply problem. Angina frequently precedes more dangerous coronary disease and marks a substantially elevated risk for a heart attack. Any recurring chest pressure that follows an exertional pattern warrants urgent medical assessment. Don't write it off as stress or a heavy meal. Recognizing this warning promptly can be life-saving. These 10 red flags are not random. They form a precise alert system, warning you that your arteries may be narrowing in ways that put your life at risk. From the mild chest heaviness of early angina to the full-blown crisis of sudden limb ischemia, each signal carries vital information about your circulatory health. Yet the heartbreaking truth is that countless people dismiss these early messages until disaster strikes. Awareness and swift action are what make the difference between recovery and tragedy. These signs rarely appear in isolation. Instead, they often reflect a broader pattern of vascular disease, where one blocked artery hints at trouble throughout the entire system. If you notice any of these warnings, especially when more than one appears at the same time, it's critical to seek urgent medical care. With arterial disease, every hour counts. Hesitation can cost you your limb, or even your life. Think of blockages as corrosion slowly building inside a water pipe over many years. For a long time, you might not notice, but then, one day, the pipe bursts. Similarly, the heartburn you dismiss as stress, the leg fatigue you chalk up to aging, or the shortness of breath you think comes from lack of exercise may actually be your body's way of pleading with you to take action before irreversible harm sets in. Your vascular system works as a single connected network. A narrowing in the arteries of your legs can hint at silent damage in your coronary vessels. Even something as seemingly unrelated as reduced sexual function can be an early marker of hidden arterial disease that could lead to stroke. Studies consistently show that people who recognize these early indicators, and take them seriously, live longer and healthier lives compared to those who wait until catastrophic events occur. The science leaves no doubt. Catching arterial disease in its early stages can prevent heart attacks, strokes, and sudden circulatory collapse. Your survival could depend on whether you pay attention to these warnings today. Don't let yourself become another story of missed chances. Respond when your body sounds the alarm. If you found this video valuable, type the word helpful in the comments to let us know. We read every single one. Be sure to like this video, share it with loved ones who need this life-saving knowledge, and subscribe for more health guidance that could change, or even save, your future. Thank you for watching, and thank you for choosing to invest in your health today.